Self-Management Network Scotland. Emma Martindale, Trellis, Scotland.
Thanks very much for having me. I'm Emma Martindale, and I, probably similar to the previous speaker, have a few different hats, but one of them is working for Trellis. So we're the Scottish network for therapeutic gardening or therapeutic horticulture. So I work part-time with Trellis, and I'm also self-employed doing therapeutic gardening and also supporting people to develop wildlife gardens in their own spaces for their well-being. So I'm going to be sharing today a little bit about a project that I've been doing with Trellis and a health centre in East Lothian. Just to give you a quick bit of background about Trellis, so we have been around for about 20 years. I've been working with Trellis on and off, probably for maybe 10. I have a background in social work and in horticulture. And my main focus has always been nature connection and supporting people to improve their well-being through nature connection, partly through my own experience of using that to support my own well-being. So Trellis has quite a wide network of projects that we support, but our main aim is to help care, health, and third sector organisations use gardening and therapeutic gardening to support the well-being of the people that they work with. So we do training for people who want to learn more. We have practitioner level training for people who are working in projects, and we support projects to get up and running and keep going. We have lots of events throughout the year, a YouTube channel, and more. So I would have a look at the website if you're interested in finding out more about what we do. So just a little bit of background. So I think probably most people now accept that nature is good for our health. But however, there's still a wide variety in terms of quality for people who don't get access to gardens, to outdoor spaces, to nature at all. And often they're the people who need the most support. And so therapeutic horticulture can be a gateway for people who haven't previously accessed nature or thought of nature as a way of improving their well-being, because through creating spaces in places that they already go to, so in health services or care services, that they can access nature, it can become a more universally available service for everybody. There are lists and lists and lots of research around the benefits for human health, but as a sort of summary, there are lots of different physical and mental health benefits through connecting with nature. Also, because of the nature of therapeutic horticulture, it tends to be in groups. So there is a lot of evidence around reduced loneliness and increased social connection. And also it provides a meaningful activity for people and opportunities for them to learn. It also helps people notice the world around them and also notice their own thoughts and feelings. So more recently, we've been using the 5 ways to wellbeing, which is at the bottom of that slide, to help people when they come to our sessions to think about what they might experience and to help them develop strategies for self-management when they're not in sessions. So we help people focus on whether they want to change things about their connection with others, whether they're having opportunities to share, to learn, to be active, and to take notice of their external and internal world. So all of those are strategies that people seem to quite quickly pick up during our sessions and talk positively about using them outside of the sessions. So this project in particular is at a health centre in East Lothian. It's Cockenzie Health Centre, which is called the Harbours Practice. So it's a fairly small health centre in an area with quite a few pockets of multiple deprivation. So the picture on the left was the practice when I first visited, and the health staff there have, I think, from what I've seen of other health centres, quite a different approach to health. So several of the GPs are part of the Society for Lifestyle Medicine, and they're really interested in looking at a whole person and all the different ways outside of traditional medicine that people can use to stay well. They have a staff wellbeing hour where all the staff in the building are encouraged to look after themselves, as well as all the work that they do to look after other people. So they were gifted a little pocket of money from a patient to improve the grounds around the service, and we managed to get some support from a local friendly garden designer and some landscaping people and the groups of patients that access the space. And we've been developing this garden that you see now on the right. So the patients are very involved in thinking about what the garden should look like, and it winds round behind the back of that building that you see there on the right. And there are lots of spaces with good seating for people to stop and connect and talk to one another. So it's a space that we use a lot, but we also have an indoor space so that if the weather's bad, we can keep running sessions and we don't have to worry about changing plans. It's hard to squeeze everything into 10 minutes, but what have we been doing? So we're running 2 12-week blocks specifically for patients with a diagnosis of depression or anxiety. The health staff and our network have experience of working with people with different mental health conditions, and we're finding that patients were really needing alternatives to medications, and there was long waiting lists for other services. So we take referrals from the GPs, and patients are given information about the 12-week block of sessions and the types of activities that we'll be doing to help them develop self-management strategies. So the sessions are a place for people to come together, and we always start off with a cup of tea, a check-in, and a chance for people to sort of connect with one another. We then quite quickly move on to doing either outdoor gardening tasks or doing indoor gardening. So that lady there has been making lavender bags. We've done activities with houseplants, lots of stuff around nature connection. And each session has a self-management focus as well. So patients have been provided with a journal or a gardener's notebook, and they're supported to take stock of what they've done that day and think about different things they might like to do outside of the session. So whether it's noticing the nature around them, keeping up connections with other people, or noticing their own thoughts and feelings and journaling about them. The journals have been a really popular part of these sessions, and people bring them back and forward with them every week. We've had a really high success rate of people coming along, which does differ from the research around medication. So we haven't had anyone drop out, and the group of patients have formed quite a cohesive group, and they self-support one another now as well. That's the gardener's notebook. So some people use them to do some collaging, lots of writing. Some people have become quite interested in gardening and are wanting to learn more. And we do some goal setting with them as well. So thinking about their short, medium and long-term goals. And they take away a handout each week to help them reflect on what they've been learning. So we're on week 8 of the first 12-week block in this setting, and patients have been self-reporting feeling less anxious. And we had people who were extremely anxious about spending time with new people. People who were visibly shaking when they came along are now walking in feeling much more confident. People are now thinking more about after the sessions and how they might access different community-based activities to maintain social connection with others. Lots of the patients are discussing enjoying learning and revisiting activities that they've enjoyed previously or accessing new activities. And several of the patients are now working with another member of staff at the practice to look at future voluntary or employment activities. And we have really noticed an improvement in everyone's mood. So the first few sessions, people arrived nervous, talking about when not wanting to come, but they had made themselves come because they wanted to support others in the group. And now people come along much happier, chatty, sharing how they're getting on, and with a real sense of purpose and hope for the future. And just a quick summary about Trellis. So As I mentioned at the beginning, we are a service that provides information and support to others. So if you have a look at our website, we do have lots of activity sheets. We have live demos that are free for people to attend online, lots of activity videos on our YouTube channel, and a monthly email which gives garden bites. So that's little suggestions for activities you could do with people you're working with. And then we have lots of training as well that you can access. And I'm happy to hear from people now or by email. So I've popped my email address there at the bottom.